My name is Susan Blaustein. I am the founder and executive director of WomenStrong International. It's a global nonprofit, currently with 19 member organizations in 16 countries, all of which participate in our learning lab and are funded by WomenStrong to carry out projects focused on girls' education, women's health, and preventing violence against women and girls. We had a full slate of programming scheduled for this year with technical assistance in these three areas of learning: girls' education, women's health, preventing violence, a lot of sharing and collaboration amongst the members, and capacity building for the organizations themselves. But when the pandemic hit and schools and clinics and community centers all closed, we quickly realized that our members weren't going to be able to carry out their programs and could very well have their hands full just coping with the emergency. So we set in motion a series of actions to respond to the moment. First, we made all our grants unrestricted, freeing these organizations to do what they needed in order to support their staff and to respond to the needs of the communities with which they work. Then we called each member just to check in, to learn what was happening in their cities and communities, and to find out what each most needed in order to respond effectively in terms of technical assistance that we could then provide. We then completely rewrote our work plan and offerings in response to those needs. We put together a series of webinars and online consultations where we check in on one another, offer strategies for self-care, for conducting effective remote programming, as many of them are now doing, on crisis communications, monitoring and evaluation, and for engaging men and boys in reducing violence against women and girls, which, as you know, has gone up during this shutdown. Our whole learning agenda has changed as a result, but our theory of change has not. We're still looking to learn whether and how grassroots organizations can grow stronger and more effective by virtue of being part of a community of mutual learning and sharing, where they're trusted to speak reliably about their community's needs. It's just that right now, instead of those needs focusing on reproductive health care or keeping girls in school, they may be about access to food security or healthcare or clean water as the emergency continues. And then finally, we continue to check in with our members and to adapt our own programming in response to their needs as those evolve. There's so much from the COVID crisis and our response to it that can readily be applied to the climate crisis, I think. But I'll start with just four things. Let's call the disproportionate burden of the crisis, the COVID crisis, on communities of color, a revelation of the systemic starving of public sector resources going to those communities, from safe housing, water, streets, schools, energy, and transport, to equal access to healthcare and the economic opportunity that enables one to have basic food, housing security, and to live a dignified life. Just this morning, a new study appeared in the Journal of the American Medical Association showing that just as the effects of climate change itself and air pollution disproportionately put communities of color at risk for COVID, climate change and air pollution also specifically put pregnant Black women and their newborns at risk, including the children's later cognitive development. So these linkages are just increasingly obvious. Second, in most marginalized communities, just as we see in populations in conflict and post-conflict settings, such as where we work in Afghanistan, South Sudan, and Mali, and those living under repressive regimes, such as our WomenStrong members in Cambodia, the Philippines, Rwanda, and Zimbabwe do, and as we're experiencing increasingly right here in the US, truthful information is very hard to access, which endangers both one's health and one's capacity for thoughtful decision-making. This is clearly the case as well for climate-related emergencies. Think wildfires, drought, floods. Just think Hurricanes Katrina and Sandy, which, like the zoonotic virus that triggered this pandemic, are increasingly likely due to the climate crisis. Then the third thing is just a confirmation of how much leadership, flexibility, resilience, resourcefulness, and response capacity exist in low-income communities that have been shut out of power for so long. Effectively, they've created their own safety nets, resourced with social rather than financial capital, but powerful nonetheless. So these can and should be tapped, paid, trained, equipped, and mobilized. But with such a community-based approach not likely to be realized anytime soon in most places, I'd say finally that building coalitions and networks among these resourceful organizations is absolutely critical to an effective response, whether for prevention, adaptation, mitigation, or evacuation, rescue, and recovery. We have a terrific member in Guatemala, for instance, working with us on girls' rights, that quickly partnered with organizations, other community-based organizations focused on nutrition, reproductive health, and violence to get public service announcements full of important public health information related to COVID in the native Maya languages out to their communities through many kinds of media. They commissioned the production of face masks and organized both an emergency food delivery system and a hotline for reporting domestic violence. It's been truly remarkable, and it took every one of those organizations to bring its own expertise to the tasks at hand. Oh, thank you for that question. You can certainly read and learn more about WomenStrong and our awesome member organizations on our website, womenstrong.org, where you can also support our work with a donation. Thank you for considering. And you can share about our work and give us your feedback on our Facebook page or on Twitter. You can read and share my recent posts on Medium or in Ms. Magazine, and you can reach us by email directly at info@womenstrong.org.